Okay, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment first. We'll show you what that looks like here. There's our cannula on the medial side coming in. We're going to back it up a little bit so you can see the probe coming through it. So this is the meniscus in the kind of the body and the anterior horn. And then as we get back here, this is more the posterior horn. Hold the camera just for a second. Okay, and so now we'll get back here and look at the posterior horn. We're just waiting for it to slowly clear up here. It's looking a little better. Okay, so the articular surfaces look good. The tibial plateau looks good. The femoral condyle up above looks good. Table down just a little bit, please. Great. And so now we can see the posterior horn, and we know from MRI scan it looked perfect, and so far I haven't seen anything to make me doubt that. That looks really good. We'll look in the central part of the knee. This is the anterior cruciate ligament here. Your knee was stable when we examined it under anesthesia, so this ACL is working pretty well for you. Behind this is the posterior cruciate ligament attachment, and this is where the ACL is back through here. And now we're going to start to peek into this lateral compartment where you have a lot of arthritis and this meniscal tear. So we can see the joint surfaces down below. You can see you've lost some cartilage here. You can see this kind of obvious meniscal tear here that we're going to do everything we can to save. You see some wear and tear changes on the femoral condyle with some areas of full thickness cartilage loss. So a lot of arthritis in this compartment. Wish you didn't have all this, but we'll do our best to address it here in just a minute. Okay, so here's the first stitch. See, we've got that meniscus repaired right at the popliteal hiatus. That's the popliteus tendon back behind. So we did what we call kind of a hay bale technique, where that suture goes all the way around the meniscus to hold it together. And now we're going to place one more a little bit to the left, which is a little more anterior. Okay, so we've got our second stitch around. You can see how we're now holding that meniscus together. At the very, very end of the case, we're going to inject our PRP right there using a spinal needle, probably a 22 gauge spinal, maybe even a 25 if you have one. But and we may even do you have a little microfracture all? Okay. And in the meantime, we're going to look up at the patella while they get those things ready to go for us. Here's the patella, the top of the screen here in just a second. There it is. We'll pull back and give you a better shot. So there's your patella. There's the trochlea, which is the groove the patella slides in. This would be the medial gutter over here. That looks clear. Lateral gutter is going to be over here to the left. We'll look at that in a minute. So the bottom line, though, is the articular surfaces look great every place but the lateral compartment, which has a lot of arthritis in it. So as we sneak back over here to the lateral side, you can see these areas here that we're dealing with. So I'm going to work a little bit more. We'll come back up on the video one last time before we go. Okay, so we've done a few little microfractures, and now we're going to have a look at this meniscus and placing some PRP into it. I'm likely going to start in the back, and then I'm just checking my angle here. Okay, so we'll show you some more in just a minute. Okay, here you go. Okay, so what we're showing you here is we've got the needle in at the meniscocapsular junction to inject our PRP. We've turned down the pump pressure a little bit. And although you can't see it unless you look really closely, we're actually injecting right now. You can see those tissues start to fluff up behind the meniscus there. And that's actually some of the PRP, so we know that we've got that pretty full up. We'll pull back a little bit. We don't want to do anything to disrupt the repair. The closest place I can get to capsule again is right about here. You can see how we're doing that right there. And now we're going to turn off the pump and finish up here. So good luck to you now. I really hope this does the trick for you, okay? Bye-bye now.